the discovery of insulin really changed the life of someone with diabetes when it was discovered 100 years ago. Prior to that time, type 1 diabetes was really essentially a death sentence for those who were diagnosed with it. There are some very famous pictures of young children who were diagnosed with type 1 diabetes and really became emaciated and looked like they were close to death. And then afterwards, after they had received insulin, looked like healthy young children that they should have been. And so the discovery of insulin changed type 1 diabetes from something that really couldn't be managed to something that became the experience, really not what we have today, because it has evolved so much over time, but it allowed people to at least live day to day and eat and participate in activities. It was really changed it from something that you were counting the days to a situation where you could live with it. The care and management of type 1 diabetes has evolved tremendously since the time that I was diagnosed. It was 1978, and I was 4 years old when I was diagnosed. Fall and spring tend to be those times where it really peaks, and I had that same experience. It was just after Halloween and right before Thanksgiving. At that time, we had just a very limited amount or number of different types of insulin. When I was diagnosed, we were using pork insulin, and we were testing sugar in the urine rather than in the bloodstream or in the, now with continuous glucose monitoring, the subcutaneous space. So it was really very limited in terms of how we were able to manage it. I initially took 2 shots of 2 different types of insulin per day. And I really felt like, looking back, the approach was, we're going to give a lot of insulin at one time, and then you have to kind of keep up with it throughout the day by eating. Whereas today, we give insulin to try to match what we're going to eat. So it's a much more physiologic approach. Rather than feeding the insulin, we're using the insulin to cover what we choose to eat. In terms of the monitoring of diabetes, I think that's been a tremendous not only improvement, but just an evolution of the way we did it. Initially, when I was diagnosed, we had this little chemistry kit. You would collect a urine sample and then mix that with a tablet that created a little bubbling experiment, and then you'd hold it up to a chart. And we did that several times a day, but it really didn't tell us very much information, because the sugar that's in the urine really can be there over a number of hours, where if you're testing sugar in the blood or in the subcutaneous space, in the interstitial fluid, you're getting an immediate assessment of what the value is at that moment. And so you can make much more informed decisions. The delivery of insulin has changed tremendously. I was on a couple of shots a day of insulins that really didn't match up well with the foods that we were eating. One was sort of not, it didn't last long enough, and the other one didn't have an onset that was quick enough and lasted a little bit too long. Now we have insulins that are very, very rapid in terms of their onset, and so you can give insulin and have it match up with what you're eating. I use an insulin pump that delivers insulin and adjusts in real time based upon blood glucose trends without me having to do as much work as I used to do. And that's been something that's changed even over the last couple of years. So we're seeing, we saw a slow evolution over the last 30 years, and then a really rapid evolution over the last 10 years in terms of delivery and monitoring. the relationship between someone with diabetes and their healthcare provider is really critical. It is so important to have a trusting and cooperative relationship to have success. The management of diabetes, unlike many health situations that we may encounter in the medical field, is one that is really managed primarily by the individual with diabetes on their own. I see someone with diabetes every 3 months or every 6 months in the office, but diabetes doesn't take a break during the times where they're not face to face with me. They're managing it minute to minute, day to day, making decisions that directly impact their diabetes control. And so building that trust and strengthening the person with diabetes knowledge and understanding of how diabetes is best managed really is critical. I feel like diabetes self-management is as critical as any aspect of diabetes management. And so if someone doesn't feel comfortable managing their own diabetes and doesn't trust that we've built up that knowledge and understanding, then they're really not going to have the same success as someone who feels confident and comfortable making decisions and adjusting the way they manage day to day. That's I really try to build trust and a foundation of a cooperative relationship with every patient that I see. I think it certainly helps that I have type 1 diabetes, and I don't keep that a secret. I tell people about it because I think it helps to build that trust. They can look across the table and see someone who has experienced many of the same situations that they've experienced, has an understanding of the trials and tribulations, the struggles that they may have gone through in their lifetime. I think the empathy that I can offer is really a strength that I have in terms of my interaction with individuals with type 1 diabetes. And I think that makes someone with diabetes more confident and more able to manage their diabetes, both independently and in cooperation with myself. I really feel like that's a critical aspect of diabetes management. I think in terms of the evolution of diabetes management, I think the automated insulin delivery platforms, using a continuous glucose monitor and an insulin pump together has really been one of the most important steps forward in diabetes management, taking away the minute-to-minute burden from those of us with diabetes, while also improving the outcomes that we're getting, has been such an important step forward.